this is Lloyd Hay, and we are here to talk about scoliosis. And so I've got one of my patients here who's going to introduce herself and share about her experience with Schroth and how we first met and what's happened and what did we get on the news today.
My name is Ruth. I live in East Tennessee. I have known Dr. Hay for years, and known that I had scoliosis for years. Came to him many years ago for baseline. About 3 years ago, I started experiencing pain, waking up at night, not being able to do much physically without being worried that I was going to hurt my back, not working out because I was afraid I was going to do damage, not traveling like I wanted to. I came back to Dr. Hay and he sent me to a Schroth physical therapist, and I was very fortunate that there was one nearby where I lived, and she showed me the exercises and taught me what I could do, which basically is everything now. And now, a year later, my curve has actually, I'm 65 years old, and my curve has actually improved.
6 degrees.
And I am not in pain at all. I work out with a trainer 3 times a week with weights. I walk about 25 miles a week. I feel better than I have in years.
And initially when you came to me, weren't you thinking surgery?
I came to Dr. Hay a year ago because I was in so much pain, and my husband and I wanted to travel, and I was afraid that I needed to have back surgery, and I knew I had to have it while I was young enough to get better.
And before I retired.
Before Dr. Hay retired.
So what would your advice be for an adult patient with scoliosis?
Find a doctor like Dr. Hay that specializes in it and knows about it, and that promotes Schroth, that doesn't immediately say you need to have surgery. There might be something else you can do. And then make your core stronger, do your Schroth exercises, and just stay on top of it.
And what would you say to a family that has a child with scoliosis, or if you were a child with scoliosis, what advice would you give to that child?
Please take your child to a specialist and get it looked at and fixed while they're young, because I've lost, over my life, I've lost 4 inches in height, and I don't want to end up like my grandmother, completely hunched over, which I'm working very hard not to do. And you don't want your children. People shouldn't want their children. There's so much that can be done now.
That's right. And especially with early screening, get your kids screened early.
Absolutely.
Because as we've talked about, if we can catch it in that green zone,
exactly,
and then we get them braced and or with Schroth, we can often reverse it.
And the right vitamins.
Right. Vitamin D and all that as well.
I started taking a lot more vitamin D and calcium than I was taking, and it's helped me enormously. I came in here today just because they told me to come, but I feel great.
That's great. Well, that's good advice. Thank you for sharing.
And I'm very grateful.
You're welcome. All right, thanks for sharing.